Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right, guys. So I welcome one and all in tonight's class. A very, very important class on infertility. And we have our presenter, Namrita, and we have Pooja as well as Divya, who are going to help her out. And so will be my entire class. So over to you, Namrita. You can start your case. Yep.
Good evening, everyone. Hereby,
Hi.
hereby presenting a case of 24-year-old Mrs. S, residing at Thrissur, educated till BCom. She is of lower middle class, homemaker, wife of Mr. R, 29-year-old, driver by occupation. She is complaining of pain during menstruation since 2 years, and she is also anxious to conceive and married for the past 4 years, living with her husband.
Okay.
History of presenting illness. She is having history of increased pain during menstrual cycle since 2 years. There is no history of abdominal distension, white discharge per vagina, itching per vagina, menstrual irregularities or chronic pelvic pain. There is no history of fever with abdominal pain and vaginal discharge. There is no history of bladder and bowel disturbances. There is no history of secretions from the breast. There is no history of weight gain, loss of weight or appetite, and excessive exercise. There is no history of radiation or chemotherapy.
Okay, just wait over here, Namrita. I just like to ask you one question. When she came to you in your OPD and she described about this pain and menstruations in the past 2 years and they anxious to conceive, did you happen to ask her what exactly is her main motive of coming here? And why I'm asking you this question? So my class will tell me why I'm asking you this question, and I'll ask Namrita whether did you ask this question to her? And this is very important in exam, this particular part.
Her
Yes,
main
Namrita,
motive,
you can answer.
her main motive to come to the OPD is to for her to bear more children, ma'am. Because of her infertility only, she came.
So she came. Her main reason for coming to the OPD was basically to plan to conceive, right?
Yes, yes, ma'am.
All right. And my class will tell me why did I think this is an important question at the very outset. My students are going to tell me, why do you think this question is of utmost importance to me that I have to stop her presentation in between and then ask her? Yeah, I agree that she is anxious to conceive. She is having endometriosis as per your clinical judgment. But my question is different. I'm asking you, why does this particular thing become very important to me at the very outset? Yeah, even if it is, yeah, exactly, Afroz. She is the one who understood the examiner's question fast. That's also very important because once you answer wrong, then they'll be catching you on that wrong answer also, right? So yes, I want to plan her management because and this is what I usually tell to my patients when they come and they start telling me blah 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 all kind of history. I have chronic stomach ache and my periods also they get a little deranged and sometimes I have headache and sometimes I feel weak all the time. I'm like, what's your main concern? What's your main concern? Because these are all vague symptoms. Tell me your main concern. So she's been having this pain during menstruation since the past 2 years, as I can understand. 2 years is a long, time. And if she really had that much pain, she would have come to us before, right? So the main thing, though it is coming second in the list, is probably she's anxious to conceive because she's been married since the past 4 years and is still living with a husband. So it's very essential for us to ask right over here that what do you think is your main concern of coming to the OPD? She will be more elaborate to you. Why? Because if you start treating her endometriosis as per the clinical judgment of my students, you will never be able to help her in conception. She will not be able to conceive because you'll probably be giving her hormonal pills. The topic of discussion in so many case discussions, isn't it, guys? This is the reason why I want to ask that. All right, Namrita. So we went from understanding that she's having, pain in her menses. Now suddenly we started thinking, oh my God, it could be anything from PID to endometriosis to adenomyosis, which is a class 1 CPP. So in that sense, now you want to delineate that, right? So as per Namrita, can you go step by step and help us understand why did you take this history and why did you take this negative history, Namrita?
Okay, ma'am. So she is not having any history of abdominal distension. So it can be any to rule out any pelvic tumor like ovarian mass or something. And the pelvic inflammatory disease, there can be a tubo-ovarian mass, and white discharge per vagina also to rule out vaginitis cervicitis, which can go into PID. Itching per
Okay.
vagina also same. Menstrual irregularities to ovulatory dysfunction to rule out ovulatory dysfunction. Chronic pelvic pain for mainly endometriosis. Then there is no history of fever with abdominal pain and vaginal discharge. Same PID. Then no history of bladder and bowel disturbances. Um,
Okay.
then no history of secretions from breast. Hyperprolactinemia can also be a cause of infertility. No history of
Mm.
weight gain. Hypothyroidism can have weight gain, which can also cause infertility. Loss of weight or appetite, hyperthyroidism or any malignancy. Excessive exercise also, ma'am. It can hypothalamic pituitary axis. It can affect, ma'am. Then there is no
Okay.
history of radiation and chemotherapy. Radiation and chemotherapy can cause primary premature ovarian insufficiency, ma'am.
Mm-hmm. But she was having regular periods, right? And she was
Yes, ma'am.
having normal flow also in the periods. That
Yes.
you come to later. And initially, you were just trying to delineate the causes of her pain, right? She was having
Yes.
pain during menstruation. Okay. And when
Yes.
you asked abdominal distension, itching for vagina, you're trying to delineate PID. And what about chronic pelvic pain? What did she say? There's no history.
No, there is no history of chronic pelvic pain.
Only pain during menses is there. Okay. All
Pain
right.
during menses and actually pain during intercourse also is there, ma'am.
Okay. And
Will come
since
and
she's
call
not
it.
able to conceive,
Mm.
a very, very important history which has to be asked. What have you missed out here, Namrata? And my students can help me
Regular
understand.
intercourse
Yes,
and awareness of
very important.
the time of cycle.
Fertility period, yes.
Yes.
They need to know about the fertility period and whether she was regularly with her husband. Has she ever had any kind of delayed periods, overdue periods? Any history of UPT positive ever? Maybe a
No,
chemical
no, ma'am.
pregnancy.
No, ma'am. No.
Okay. So here is very important because she came to us with two problems, right? And one of the problem, halfway we have tried to delineate the pain, the problem of pain during her menses, but that has to be delineated further, Namrita. That means when you're talking about history of increased pain during menstrual cycle, we need so much. Whenever this word pain comes, so much is supposed to be written. When does the pain start? When does the pain stop? Is it associated with any other factors? Is it always cyclical? Is it relieved on medications? Is it relieved on rest? All these things are important, right?
Okay, ma'am.
Because that will give us one more added point that you did give importance. First of all, the patient will be happy that okay, fine, I gave her a problem and she's at least trying to interrogate me on pain, because suddenly your focus shifts on conception, and then you ask questions regarding conception. That's fine as well. Has to be delineated, but again, a very preliminary and important question in this thing, ability to conceive, has also been skipped. That is regarding her fertility understanding, the period of fertility, whether they are together uninhibited, any history of any contraception taken ever. They've
No,
been
ma'am.
married for 4 years, but they've been planning since how long? Sometimes they don't have socioeconomic status in such a way that they are planning right from the beginning. Maybe they and she's a young female, 29 years, is it? Our patient
24 years, ma'am.
24 years. So that means whenever she got married, she was very young. Maybe they were not planning at that time. They started planning later on. They were not together. So these things, plus whether the male has any issues, okay, erectile dysfunction, premature ejaculation. Female has a problem
Basically,
like
ma'am, I have
vaginismus.
put it a bit later. That is okay, or should
Yeah,
I
agree.
include it together?
I agree, but since this is a very important, what do I say, preliminary, part you're talking about no history of secretions from the breast, and you are not asking how often do you have coitus, whether you've ever had any contraception before, whether you've been always together. This is like, what do I say? The general things have to be asked first rather than the galactoria and all that, right? So when we ask things like galactoria, very important is that we already ask very important questions regarding to conception,
Ma'am,
which I've discussed.
coital history I've added it separately, so I was
I understand.
confused whether I should add it in
You
HOPI.
had a confusion. I
Like
understand.
3 questions will be there now, ma'am.
I'll answer your question. For example, you gave me a history that, ma'am, the chief complaints that she came was pain during menstruation since 2 years, and also she's anxious to conceive. She's already married since the past 4 years and is living with a husband. That suddenly gives me an idea that this is going towards a case of infertility. On her history of presenting illness, the patient, now since you've already told me first the pain, then you start with the patient gives history of pain since the past 2 years. The pain remains consistent only at the time of menstruation. It starts from day one of menses, continues to 2 to 3 days, relieved on this thing, pain medications, just simple analgesics. The quality of life was compromised earlier on, but it's still okay with pain medications. She used to skip the school or whatever work or whatever she's doing. She was not able to do. She was on rest, but now she has improvised that with the help of medications. No other confounding factors. Bowel bladder movements. Okay. Then you come to the history of this thing that she's not able to conceive. Patient has been married since the past 4 years, knowing her fertility period, have been together ever since, no history of any contraception use. And then you continue with your, no history of abdominal pain, no history of fever. This, if you want, you can club with along with pain. Complete your pain thing and then go to your fertility thing. So all of this will come in the presenting illness. You can put it in your obstetric history, but there it will be a repeat. Okay, you can repeat it. You should repeat it unless your examiner says that yeah, you already covered it before. Okay, but when you're talking about like galactoria and you're talking about weight gain, weight loss, and even abdominal distension, the initial thing, like especially the pain score, quality of life, that has to be covered. Okay, and initially only. Yes, continue with menstrual history.
The patient attained menarche at the age of 13. She's having regular menstrual cycles, 5 to 6 days duration, every 27 to 30 days. Her last menstrual period was 5th June 2025. She's having history of congestive dysmenorrhea. That is like 2-3 days before her menstruation itself, she was having pain. And when the menstruation started, it was the pain was decreasing. Then the pain also reduced with medications. In coming to marital history, she is married since 4 years, non-consanguineous marriage, first marriage for both the partners. She is living with her husband. There is no history of contraceptive use. Obstetric history, she is nulliparous. Coital history, she is having regular unprotected intercourse 3 to 4 times per week. There is history of deep dyspareunia. There is no history of any other coital difficulties. Or premature or retrograde ejaculation. There is no history of use of lubricants or post-coital douching, and the wife is aware of her fertile period.
Excellent, very well done. You've covered every point. It's just that a little towards the. Okay, guys, have you been writing down marital history or you like write down obstetrical history? What do you guys write down these days?
Ma'am, marital history is different. Obstetric history, separate headings will.
Okay, you mean where will you put the coital history then in that case? In the marital history, will you also put the obstetric history? Is it?
Normally in marital history only we can put the coital history, ma'am. Here I have put a different separate heading.
All right, okay, fine. So there is no history of any contraceptive use ever, and there is a good understanding of the fertile period. And okay, any treatment taken so far? Any investigations done so far? There's another question.
Yes, ma'am. Treatment history. I'll. Can I skip to
treatment? Tell it. No, it's okay. Just asked you. All right, continue.
Okay, past medical history. There is no history of diabetes mellitus, hypertension, thyroid disorders, asthma, heart disease, renal disease, epilepsy, hyperprolactinemia, and or any prolonged medications. There is no history of TB, sexually transmitted disease, recent urinary tract infection or pelvic inflammatory disease. Past surgical history. She is having a history of laparoscopic ovarian cystectomy done for left endometriotic cyst in November 2024 in a private hospital. Ma'am, one doubt, ma'am. Like in history, we are not supposed to see the reports now, ma'am. So, but I saw the reports and wrote it like this. So, should I change it?
No, not at all. You can only ask her. There are some very intelligent patients as well. Some are not able to tell anything. But you can write a query. Like, for example, you ask the patient, have you ever had any surgery before? Many patients, despite the fact they had it, they say, not really. But then you ask them any kind of operation.
She
in
knew
which,
that it is a cyst. She was telling cyst and all, and like an endometriotic cyst, she didn't know.
Yeah. So very good. Then in that case, you can only write patient gives history of query, laparoscopic ovarian, again query, because you don't know cystectomy. She's saying na cyst ko remove kiya, something like that. She must be telling you. So laparoscopic query, ovarian cystectomy, done for some cyst in November 2024 in a private hospital. Obviously, the details are not there with you, so you're presuming some cyst. Okay, so that does not change our case. It just endometriotic cyst was confirming endometriosis, but cyst will not like deter us from our main, because you already said very important thing, deep dyspareunia. That tells us a lot that she's having congestive dysmenorrhea. So this tells us a lot, though usually in endometriosis doesn't really happen that the menses start and the pain goes, but it usually happens that it continues for some few more days as compared to normal dysmenorrhea. It starts a little before and continues for a little more. But it's okay. That gives us two very important big hints. Plus, she's the history of infertility. So that gives us probably, if the examiner asks you here, what do you think would have been that cyst? But then, so you are very clear in the saying it could have been a possibility of endometriotic cyst, but it can be anything. It could be a large functional cyst. It could be a hemorrhagic cyst. It could be anything. But a couple of things can happen. So don't worry. This is a very easily manageable, negotiable thing. You can easily, sail through it, because you are maybe expecting it to be some, see that they'll be able to say Durbeen se hua tha ya open hua tha, that you can ask. That's a plain question. Then they can say that yeah, it was done through laser, they say usually. So you can say history of query, laparoscopic query, cystectomy done in 2024 November in a private hospital. That's fine.